The anatomy of the human skull is an important area of anatomy study, especially for healthcare professionals, surgeons, radiologists, and medical students. The skull is the bony structure that protects the brain and associated structures. Below I will describe the main parts of the human skull. 1. Skullcap, calvaria. The skullcap is the upper, rounded part of the skull, which forms the top of the head. It is composed of flat bones, including the frontal bone, right parietal bone, left parietal bone, and occipital bone, which are joined together at sutures. 2. Base of the skull. The base of the skull is the lower and most complex part of the skull, which houses several openings and foramina through which nerves and blood vessels pass. It is made up of irregular bones, such as the sphenoid bone, ethmoid bone, temporal bone, and parts of the occipital bone. 3. Cranial sutures. Sutures are fibrous joints that connect the bones of the skull and allow some movement, especially during brain growth during childhood. Examples of sutures include the sagittal suture, between the parietal bones, the coronal suture, between the frontal bone and parietal bones, and the lambdoid suture, between the occipital bone and parietal bones. 4. Eye sockets. The eye sockets are bony cavities in which the eyes are housed. They are formed by parts of the frontal, ethmoid, lacrimal, zygomatic, maxillary and sphenoid bones. 5. Nasal cavities. The nasal cavities are the cavities in the nose that play an important role in breathing and smell. They are formed mainly by the nasal bone and parts of the maxillary and sphenoid bones. 6. Cranial foramina. Foramina are openings in the skull through which nerves and blood vessels pass. Examples include the foramen magnum, in the occipital bone, through which the spinal cord passes, and the foramen ovale, in the sphenoid bone, through which the trigeminal nerve passes. 7. Mandible, lower jaw. The mandible is the only movable bone in the skull and is responsible for chewing and articulating the jaw. It consists of the upper jaw, maxilla, and the lower jaw, jaw proper. 8. Teeth. Teeth are anchored in the upper and lower jaw and are used for chewing food. They are classified into incisors, canines, premolars and molars, each with a specific function in chewing. Understanding cranial anatomy is fundamental to medical practice, especially in specialties such as neurology, head and neck surgery and radiology. Furthermore, it is crucial for the diagnosis and treatment of injuries and conditions that affect the skull and its associated structures.